Okay, here's your Ask Dr. Rajani question of the day. Remember, in the more info below, if you want to ask a question, certainly ask it. I'll play it back and answer it.
Hi, my question is whether PDO threads contradict RF technology. I've heard that if you get PDO threads, you should not get RF treatments because the RF treatments will melt the PDO threads. Thank you.
Okay, that is an absolutely wonderful question. PDO threads, more and more popular, have many videos on them. RF radio frequency, so things like RF micro needling, Morpheus, Secret, Infinity, Genius, those are common ones. There's probably 8 good ones on the market. And remember, most importantly with those is who's using them on your face. Out of the top 8 devices, it's not the device, it's the person doing it and the settings. But if you have PDO threads, will it melt them? Will it affect them? There's also RF like Exelis, like Viora's VFR, like Viora's technology that uses external RF bulk heating to help reduce fat into contour. This would include for those PDO threads, and I'm going to include PCL and PLLA, the 3 most commonly used, have a high melting point above 100 degrees Celsius, at which point your skin would burn quicker. So the device is unlikely to melt your threads if you have a good quality thread. Once again, the result of a PDO thread lift or PDO threads used to build collagen depends on the threads used. How many threads crumble because they've been exposed to oxygen, they're old, they're not thick, the design is poor, the barbs are poor, the molds are poor. If you don't know what the barbs and the molded mean, just search in YouTube, Rajani molded threads. I described that, Rajani barb threads. It's all on YouTube, it's all here. But the design of threads is all important. And then of course, who does them for you? People lump, oh, I got a thread lift, didn't like it. Well, who did it for you? So it's very user dependent. Some treatments are very user dependent, others aren't. PDO threads are, fillers are, biostimulators are. So it will not melt. Now, there's a caveat here. Some of them use suction. So some of the face contouring radio frequency devices use suction. That will suck the thread up a little bit. It won't melt it, but it can straighten it. It can unhook the barbs. So if you have a puckering or a side effect, those devices can help get rid of the side effect. It will not actually melt the threads. What do I do in practice? One of the things about these videos, understand I'm telling you what I see every day in practice. You get all the studies in the world. It doesn't mean very much when people are talking about it if they're not seeing patients. Okay, so I'm telling you what I see. I use it same day, not a problem. RF microneedling and threads, same day. I don't see a problem. And the chance that that needle, the RF microneedling device I use, the very tip heats. And in that sense, I'm not going to get the pigment problems that you can get where the whole needle has heat through the duration of the needle. So I like to use RF microneedling to remove fat from certain areas, okay? And that's how I use it. But I use it same day. I'm not worried about it messing up the thread, but you can get ones that suck, and that could change how the thread is. I would use the word engaged. Same thing with filler. Filler has a very high melting point. In fact, some of it is autoclaved. A lot of it is before we get it. So it's heated to high temperatures for antibacterial effects. There you go. PDO threads and RF microneedling. Great, great combination. That's what I do in practice. I can't tell other people what they should do in practice. It's what I do. Ask below if you have a question. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.